Hello, thank you for joining us. I know people are just joining, but we're going to go ahead and get started. Welcome to today's webinar, Activating Health Professionals to Lead Climate Action, presented by the National Academy of Medicine, the Institute for Healthcare Improvement, Healthcare Without Harm, and Practice Greenhealth. My name is Amy Collins. I am an emergency medicine physician and the medical director of physician engagement and education at Healthcare Without Harm, and I'm going to be facilitating today's webinar, and thank you again for joining us. During today's webinar, we will be using Slido, an audience response system. We will not be having audience question and answer period, but we do encourage you to utilize the Q&A tool under the live stream, which will be monitored by NAM staff to interact with one another and ask questions. I want to share a little bit about today's agenda. We're going to start with an engaging panel discussion with three inspirational health professional climate health leaders. And following our conversation, we'll briefly review some educational resources and conclude with a few closing questions to gather your feedback. What we're going to do now is review the objectives for today's webinar. We're going to describe effective strategies to engage peers to advocate for climate action, raise awareness among organizations of opportunities to lead climate resilience and mitigation, and share health professional climate and health resources. Next slide, please. Today's webinar, as I said, is presented by three organizations: Healthcare Without Harm, which works to transform the healthcare sector worldwide to reduce its environmental footprint and promote sustainability, and is a leader in the global movement for environmental health and justice. Its sister organization, Practice Greenhealth, is a membership network of more than 1,500 hospitals and health systems and provides sustainable healthcare resources, expertise, and support. The Institute for Healthcare Improvement has a mission to improve health and healthcare worldwide. They partnered with the Association for Healthcare Research and Quality to develop a guide to help healthcare organizations reduce their climate impact and reduce emissions in 6 domains. And they've also partnered with a number of healthcare organizations in an effort to accelerate lower emissions healthcare delivery using improvement methods and sharing best practices on measurement strategies, leadership engagement, and culture change. Recognizing the critical need to address climate change through health sector leadership, the National Academy of Medicine launched the Action Collaborative on Decarbonizing the U.S. Healthcare Sector, a public-private partnership of leaders across the healthcare sector committed to addressing the sector's climate impact while strengthening its sustainability and resilience. Known as NAM, they will be launching the second phase of the collaborative in early 2024. Next slide, please. It is now my pleasure to introduce today's panelists. Dr. Harleen Marwah is a pediatric resident at Children's Hospital of Philadelphia and the founding chair of the medical student organization, Medical Students for a Sustainable Future. Kayla Williams is a fellow with the Alliance of Nurses for a Healthy Environment and a climate and health ambassador with Eco America. And Dr. Noe Woods is an obstetrician gynecologist at the University of Pittsburgh Medical Center and the Assistant Dean of Healthcare Sustainability at University Pittsburgh School of Medicine. You can check out their complete bios in Slido. So I'm hoping the panelists can now join me and we can start our discussion. Great, you all with me?
Yes, we're here.
Okay, great.
Hi.
Yeah. So I would like to start our discussion by asking each of you to share how you got involved in climate action and let us know what motivates you to continue to do this work, especially given all the demands on your time as very, very busy health professionals. So Dr. Woods, why don't we start with you?
Sure. Thanks for having me, Dr. Collins. It's a pleasure to be here. And I find myself being really curious about the participants here. But I'll let you know about me. So what motivates me for this is that I find this work basically is the antidote to eco-anxiety for me personally. So the only thing that helps regulate my breathing and sort of deal with my feelings of overwhelm about the planet is doing this. I read this really great description of hope, which was this idea that hope is not a belief that the future is going to be a certain way, but the capacity to imagine it. I read the book Electrify, which is essentially a really good read, and it teaches you about a path that could work for the United States. I kind of needed to see that in order to have hope. I needed to feel that hope wasn't futile. And reading that book really made me recognize that there is a capacity. We have the technology for this to be quite different. And that allowed me to really dive in, actually. And so working on this is the thing that brings me lots of joy. You're still muted, Amy.
Why don't we turn to Kayla?
Certainly. Thank you, Dr. Collins. It's wonderful to be here. What motivates me? How did I get into this part of practice? I think I must have been an environmentalist from a young age, because I recall using my birthday candle wishes for protecting the trees and saving up gum wrappers to adopt a whale. So certainly having a deeply felt lifelong connection with nature is a motivating factor for me. I didn't begin thinking about a connection between the nursing profession and environmentalism until I joined the Resilient Activist and participated in their visionary activist programming. And that programming helped me to identify through lines and themes that have been present throughout my life and look for ways my professional nursing career could serve environmental causes. And so I began looking for other nurses who were integrating environmentalism into their work. And that's when I joined ANNE, the Alliance of Nurses for Healthy Environments, and a local environmental justice organization called Clean Air Now. And they're a community-led organization in the Kansas City region where I'm from. And they work to protect the health of fence line communities whose health is being harmed by environmental racism and the unequal distribution of environmental hazards. From them, I learned that my neighbors could have as much as a 22-year shortened life expectancy compared to other neighborhoods because of the cumulative impacts of environmental hazards. And so for me, it wasn't enough to just care for patients only after they become ill, but as a health professional to work to protect their health. So this isn't some big hypothetical, abstract, and distant concept. It's something that's happening in our own backyards, and people's lives are at stake. So love for my neighbor motivates me now.
Thank you for that. I appreciate that you mentioned wanting to find your allies and joining ANNE. I think many of us who are doing this work need to find our allies, and joining a group is a way to do it. And I think that's a theme that'll come up again during this session. So Dr. Marwa, why don't we hear from you now?
Great. Yeah. Thank you all so much for having me today, and for the organizers for putting together such a wonderful event. Kayla, I see a lot of similarities to your story with my own. I think back to my own childhood too often when I think about this work. I grew up in a region of Southern California with some of the worst air quality in the country. And while I don't think I realized it at the time, my childhood was impacted by increasing incidences of wildfires and more frequent droughts. And I was seeing how health is influenced by a multitude of factors, and the importance of taking that full picture into account when prescribing solutions. To really effectively promote health, I was seeing that we needed to consider influences like climate change, both inside and outside of the traditional clinical setting. I think it was later through my experiences in education and my work that I affirmed climate change is the biggest health crisis that our generation will face. And as many of you attending today might relate to, the more I learned, the more I felt charged to advocate. I was really fortunate to have some opportunities to amplify the health message as a youth delegate to the United Nations climate negotiations, COP20 and COP21, where the Paris Agreement was signed. And it was at those meetings I saw firsthand how clinicians and health professionals can be incredibly powerful advocates for their patients. I was inspired by those who were elevating their patients' stories and voices that weren't traditionally represented at these decision-making tables. And it was ultimately originally at the COP21 meetings that I made the decision to go to medical school. So when I got to medical school, I was really excited to join a community in health that was focused on tackling the climate crisis. And to my surprise, I couldn't really identify many medical students who were working on this issue yet. But I felt confident they must be out there. I just hadn't met them. And so I actually connected with Dr. Collins in Healthcare Without Harm, and she was able to introduce me to a couple of medical students around the country who expressed an equal interest in working on this issue. From that original 6, we quickly grew to 10, we grew to 100, and now just over 4 years later, we're at over 700 medical students and upwards of 100 medical schools who form Medical Students for a Sustainable Future, along with like a robust alumni network. And it's really just signaling, I think, the eagerness, but also the urgency that trainees feel to tackle this issue now. And I think kind of underscoring what motivates continued work in this area is communities like Medical Students for a Sustainable Future. It's really important to find your climate and health community. It makes the work sustainable and more meaningful, especially when it can feel existential. I think patient trust, seeing the trust that we receive from patients and families in a clinical setting every day, just reinforces the responsibility and privilege that we have to advocate to make things better. And I think going all the way back to hope, as Dr. Woods mentioned earlier, really seeing climate change, I know it's often framed as a huge threat, but it's also a really great opportunity to reimagine a healthier and more equitable future.
Mm-hmm. Yeah, thank you for that. I remember very, very well when you reached out to me, and we're going to touch on the success of Medical Students for a Sustainable Future. A couple of questions from now. So, Dr. Woods, I want to turn to you. In my role, I think the question I am most frequently asked is, can you give me some advice how I can make the pitch to my leadership to make a commitment to climate action? So how did you do it? How did you and your colleagues at UPMC so successfully make the case to your leadership to make a significant commitment to climate action, and maybe touch a bit on, what the keys to that success were?
Sure. I'm going to talk as fast as I can because I know I've only got 3 to 5 minutes. It was a lot. In the beginning, there were a couple of clinicians floating in the ether who were interested in sustainability. The medical students came to us and said, we want a curricular change. And so we entered a competition for climate change curriculum and we lost. But we found these 4 docs who really cared and who were willing to volunteer their time. The 4 of us then held ourselves accountable by scheduling regular meetings. I cannot emphasize how important that is as a first step. Number 1, you need to like the people. And number 2, you need to meet on a regular basis. So we started doing that. We actually joined the Harvard's Climate Health Organizing Fellowship, which also gave us a sort of a structured time to meet. While we did that, we gave ourselves a logo, and then we wrote a very specific mission statement to focus our efforts. And I can't even say how helpful that mission statement has been over the 2 years that we've been doing this. Then we started to accumulate folks, right? So it started as 4, it's now 547 clinicians. And I wrote a letter to our CEO that was garbage, and I sent it around to 10 really smart docs. And when it came back to me, it was a work of art. And what it was very specific asks of our leadership. So we had 6 or 7 extremely specific asks in the context of our belief in our system. So we very much wanted to work with our system. We very much wanted to hold up what they were already doing. And we really truly believed that they could be a leader in this. We did not approach it as antagonists. We approached it as, we're your employees. We believe in you. That was important. Then we sent this, then we had a bunch of doctors sign it. We didn't go crazy trying to collect signatures. We just sent it to people we knew. We ended up with around 300 signatures, and we sent it to our CEO on Earth Day. There was multiple things that happened at once. So we sent a letter at the same time that some environmental groups reached out, at the same time that one of our internal UPMC leaders had just been kayaking with whales and decided that he really needed to do something about this. So all of these things came together. Serendipity happened. Our CEO knew me and knew the other people that were approaching her. And we knew that this is something she cared about. And 12 hours later, we got a, yes, let's do something. And so, and I think though, that makes it sound really quick, but a lot of things went into that, right? The people who approached leadership were known to leadership. Were known to have already volunteered a lot of their time and efforts to demonstrate like really caring. The way that we established this reputation was giving grand rounds, holding conferences, doing projects with low-hanging fruit that saved the university money, that sort of thing. Getting some press, getting a little bit of PR that was good for the institution, all gave us the momentum we need to get a yes. We wormed our way onto the steering committee. We had to demonstrate that clinicians did know a little bit about this. The facilities folks and the EVS folks were like, why do you guys care? These things magically appear for you, but we had to learn to work with them and learn to learn from them. So that was a big part of it. And then the last thing I'll say, because I'm probably approaching 5 minutes, is personal connections. So all of these folks who were interested and who gave ourselves this name and got a website and all these things really started making personal connections with people who made decisions. And then we got lots done, and there's still a lot more to come. So that's how we did it.
Yeah, I've heard that story before and always enjoy hearing it. And maybe there'll be time for you to touch a little bit more on what the asks were.
Sure.
The asks were things such as sign on to the HHS pledge. I think you've established a sustainability office. You have a chief medical sustainability officer, join Practice Greenhealth. So really have gotten a lot done, since that time. So Kayla, I'm going to turn to you now and ask you a question. We just heard how Dr. Wood's work has primarily focused on efforts within the healthcare sector, but you're taking action in a different way. So I'm hoping you can tell us a little bit about your work advancing equitable climate solutions through advocacy, along with your work as an Annie Fellow.
Sure. So over the last year, I've had the privilege of participating in the second cohort of the Annie Environmental Health Nurse Fellowship. And the purpose of the fellowship is to train nurses to work at the community level, to work to tackle serious environmental health issues. And the fellowship emphasizes the unique position nurses are in to address climate change. Nurses are highly trusted members of our communities. We're the largest health profession by numbers, so we have a big collective voice, and we're systems thinkers. We see people in the context of where they live, work, and play. So during the fellowship, I partnered with the community-led organization Clean Air Now, which I mentioned before, and we worked together on a project they requested to develop an environmental health action plan. And this is a product that will help community become leaders. And so, which we completed this, we'll have distribution in about a month. But for me, it was a deep dive into learning about this community and to engage in relationship building, to go outside of a health system or an academic health system and walk in the streets with them, see where their homes are situated, to build relationships, which is essential for advocacy. So if I can give everyone on this call one assignment, it would be to connect with the fence line community in your area so that you understand their issues, because you'll learn about the cumulative health impacts they face, which can be a combination of medium and heavy duty trucks, proximity to rail yard activity, recycling facilities, and legacy contamination, and that there is unequal burden of these environmental hazards, which is closely related to environmental racism and redlining. So I now have a better understanding of how nurses can use our skills to support these communities in their policy advocacy, their data collection, environmental health promotion, and education. But we do that through followership. So these communities are the experts on their neighborhoods and how their health is impacted. And health professionals, we can lend our trusted voices to support their needs. That will help ensure that any solution is equitable for everyone and not drown out their voices by the industries that are causing the pollution. And then at the national level, participating in the fellowship gave me an opportunity to join the Climate Action Campaign along with dozens of other health professionals in Washington, D.C. And during that visit, health professionals were paired with these communities and these fence-line communities and other organizations for 2 days of meetings with Congress and their staff. And our focus was on strengthening the EPA's air quality standards for fine particulate matter pollution, which contributes between 85 and 200,000 excess deaths per year. So by focusing on the health impacts, that might seem obvious, but I'm surprised how often it's left out of the climate resilience conversation and planning. I can go to whole day-long presentations about a regional climate resilience plan, and they barely talk about health. So there's definitely a need for us to center this as part of the conversation. And regardless of your professional background or educational background, centering health and the voices of those experiencing the greatest burden, through the health lens, we're looking at things in greater than a strictly economic or conservation lens. So that not only aligns with our values as health professionals, but it has the added benefit of allowing us to address issues that representatives already have concerned themselves with. So that could be maternal infant mortality, mental health, care for veterans, stress from job loss, and K through 12 education. Because climate change impacts every aspect of our lives and our health, we can guide them to conversations and research and evidence that supports the issues they're already concerned with. So that's a lot of what the training and the fellowship has been with, and hopefully in that process I've gained lifelong friends and built relationships that will help me to advocate for my local community going forward.
Yeah, thank you. I appreciate your comments and communicating that health professionals and the healthcare sector has an opportunity not only to reduce its own contribution to the climate crisis, but also to make sure that to promote community and health climate resilience. So, Dr. Marwa, I'm going to now ask you to talk a little bit more about Medical Students for a Sustainable Future. You already talked a little bit about how it was formed, but I'd like to hear, how it grew to be an independent, successful organization. Ask you to share a little bit about the group's focus areas along with some of your successes.
Yeah, thank you so much. And it's been so inspirational already to hear about all the amazing work that my co-panelists here have been leading. As I mentioned a little bit earlier, Medical Students for a Sustainable Future really grew out of a need that hadn't been filled yet. We have, training clinicians who are concerned about the climate crisis and the impact it's going to have on patients today, but also the patients we'll take care of throughout the course of our career. And we want to feel equipped to care for those patients in the context of our changing environment. And so I was fortunate to, connect with Dr. Collins and Healthcare Without Harm, start to find medical students around the country who wanted to work on this issue now. And from there, word spread through word of mouth and grassroots efforts. And I don't think we anticipated how quickly the group would grow, but it really signaled that climate change is top of mind for training clinicians. Some of the other, I think, key pieces of the growth included forming partnerships with organizations who were leading the way when it comes to climate and health. And so Healthcare Without Harm, the Medical Society Consortium for Climate and Health, Physicians for Social Responsibility, they'd already been involved in, getting clinicians up to speed on this issue, but also had networks of folks working on this topic. And whether it was faculty or other medical students or trainees, we were so excited to engage with them. I think the other key piece of this was to be really thoughtful and intentional about the unique niche that the medical student voice filled. And so we got to, talk with other organizations who paved the way in medical student activism to get some key best practices from them. So organizations like White Coats for Black Lives, organizations that have been really successful in amplifying that trainee voice. And then I think, talking kind of about the scope of the work. So Medical Students for a Sustainable Future, it's this growing community of students who feel the urgency to tackle the climate crisis now. By having a scope of work, by having a broad scope of work, I should say, we're able to see the many ways that students can get involved and be change makers. So we work on topics ranging from advocacy to research to education, climate smart healthcare, partnerships, as I mentioned before, and communications. And I think by having this scope of work, you're able to get involved in a piece of this movement that feels tangible and something that you can build into your professional career early on. You can find mentors in that space, and you can start to build yourself like a body of work in this space. I think some examples of that to really illustrate the success here are that MS4SF has now gained invitations to have a seat at the table. And so we're seeing MS4SF be invited to meetings at the White House, at the EPA, other national meetings. We always have representation at international meetings like COP. And so it's been really exciting to have that trainee voice get a seat at the table and be able to amplify the needs of future physicians. Similarly, getting coverage from media outlets ranging from the Huffington Post to the New York Times or Stat News. We've been able to get coverage out there and medical student quotes out there, which has been really exciting. And then on the other side, getting coverage in academic medical journals. And so getting medical students both to write op-eds and editorials, but also getting this work featured, I think lends credibility and legitimacy to the work. I think one of the, examples that illustrates this really well is our guide to climate and health curriculum reform. And what this is it was a guide originally created by now Dr. Natasha Sood and Dr. Sarah Shu that collates kind of best practices for how medical students can advocate for climate change curriculum to be embedded into their medical school curriculum. So it's updated kind of twice yearly. It, reaches across the span of our networks to gather best practices and examples from medical students and medical schools around the country so that we don't need to necessarily repeat building the wheel. And it includes everything from how do you write a letter to your dean? What are good examples? What are some slide examples? What are syllabi examples? What are resources for environmental justice? And it brings that all together. From that, we've had members of MS4SF go on to start things like the Climate Resources for Health Education, which is a repository of climate and health resources so that you can integrate slides and cases and other content into your curriculum. And then, we were able to amplify the work of the Planetary Health Report Card started by Dr. Hampshire. So it's been exciting to not only, innovate within MS4SF, but then create a platform so that students can go on to create other work that we can then amplify in meaningful ways. And I think ultimately that community is the biggest success of the organization, that during busy periods of training, when you need to step away to study for boards, do a very demanding ICU rotation, there's a community who's carrying the torch forward, and you're always able to jump back in. And even after now I'm in residency, I've graduated, I think I still have that community, both the alumni community and the students who are actively in it. And I think what I've seen for the alumni is that it's given us the skills, the voice, and the tools to go on and be leaders in our disciplines. And so it's been really exciting to work with my colleagues who are now speaking at their professional meetings about climate change and health, incorporating climate change and health into their specialty specific GME and CME. And it just makes me hopeful for all to come.
Yeah, thank you for mentioning the curriculum guide. It's a resource I have shared over and over throughout the years. It's really very, very valuable. We're going to turn into the next phase of questionings. We're running a little bit short on time, so I'd like you to ask, maybe keep your answers to 2 minutes or less. So Dr. Woods, we're going to go back to you. You touched upon advice in your opening comments. I wanted to know if you had anything more about advice for other health professionals who want to make the pitch to their leadership, or if you want to share more about your asks of UPMC and a little bit more about the climate efforts at UPMC.
Sure. Wow, you've given me wide open license here to say any way I wish. Let's see. Was there anything more I wanted to say about advice? I think that if you find yourself doing a sustainability effort by yourself and you are sorting through trash in the middle of the night or it's lonely, you're on the wrong track. This should be something where you have a lot of collaborators and you're feeding that human need we have for human connection, which is really the only thing that matters in the end, right? Is the quality of our human relationships. So this should be adding to your sense of meaning as a human, and whatever you can do to make that go into this work, it's going to make your life better and make what you do more effective. So you asked me for some more advice. I was going to say a few collaborations are really important. We may be getting to that later, but I think it's really important. So that the opposite of healthcare sustainability is fear of infection. These are two diametrically opposed things. It turns out that preventing infection is really about washing your hands, right? Not disposing of the entire hospital in a plastic womb. So you have to have infectious disease experts in your pocket who believe in this. So I think developing a relationship with someone who's an expert can be really helpful for advancing sustainability efforts. Since this is a smorgasbord answer, I'll tell you about our asks because these were helpful. So let's see. So the first thing we asked is for institutional commitment. We gave specific things that we wanted our institution to sign. You mentioned several of those things, but essentially we wanted some national, we wanted some announcements that said, we care about this, whatever capacity and whatever way that works for your institution. I think it's important because it gets everybody on the same page. We did ask for renewable electricity. I feel extremely passionate about this. To me, you can save energy, you can cut down on this and that, but if it's all coming from solar power, that's your big win. So we are really strongly fighting for renewable energy for our system. That's a very big ask. That's a long-term ask, but that's what we want. We asked to have a center created. Creating this center has really made everything else possible. And what I want to emphasize is that it's really not a very large financial commitment for a large institution to start a center for sustainability. These folks don't get paid like doctors, right? And you have engineers and directors and food service folks and others who then, once you have dedicated time to start calculating things and doing carbon assessments, you really can get a lot done. So our center is just gorgeous, and I love the people who are doing it. They're getting a lot of things done, and if you can get your institution to hire a few people who will do that will go a long, long way. We also asked them to develop quality metrics for research, education, and clinical care that were environmental. So when the hospital decides to buy a new WSME goose mitt, somebody needs to ask, okay, is this a good device? Do we know how to use it? All those things. But the other question that needs to be asked is, what's the environmental impact of this new device that we're thinking about? So we've really tried to work hard to incorporate our environmental quality into those three things: research, clinical care, and education. So those were some of our asks. We did talk a little bit about divesting from fossil fuels, but that's my smorgasbord answer.
Yeah.
The other thing, other thing, I also think it's really important to have anesthesiologists on board. You need an anesthesia champion because greenhouse gas emissions from anesthesia are profound. And really, just with little tweaks, we are phasing out desflurane, we are phasing out nitrous oxide, and the linchpin to that is your chief of anesthesia. That person needs to understand and be an advocate.
Yeah. One thing I hope people will take away from your comments is that you defined your ask. And I think it's really important when you make the pitch to your leadership that you're clear about what you're asking them. So Kayla, I'm going to ask you one question, and then we're going to go to our final brief round of questions. And I just hope you can try to be brief and answer it in about a minute and a half. So I think we all know, all of us on this webinar, perhaps a lot of the participants, that climate and environmental work can be both inspirational and stressful at the same time. And those who engage in this work can experience eco-anxiety and climate grief. Can you let us know a little bit about how you are working to provide mental health support for environmental activists, and this connection?
Yeah, and I think there was a question about this on the Slido, so I hope that that's helpful for the mental health professionals who are joining us today. So there's some obvious impacts of climate change on health related to heat, but weather, severe weather, and the stress from displacement and loss of life or injury or jobs. But kind of a third bucket is this less obvious, that the more we hear and learn about climate change, it can generate a lot of fear and anger and sorrow. And there are these new mental health diagnostic codes that have emerged of climate or eco-anxiety, pre-traumatic stress, and solastalgia. So we may begin to feel helpless or hopeless, and we might even believe we don't have much of a future and potentially experience a kind of climate-related nihilism. So it's important that we develop strategies to deal with these, and that's where the focus of an organization called the Resilient Activists. They're local here in Kansas City, but they have national reach. And in partnering with them, we've developed platforms for anyone who identifies as an environmentalist, and we support each other with validating our experiences and feelings. That validation goes a long way. Because sometimes those feelings are just bubbling under the surface and outside of our awareness. And if we don't validate them and acknowledge them, we may not seek the help that we need. We may kind of think, oh, well, that's just something that, happens, or not really give it the attention that it deserves. And so most importantly, to validate the experiences so that people seek professional help if these feelings are overwhelming for them. And most importantly, this has been a through line theme for all of us, is that we connect with peers and we connect and build community and stay inspired and stay supported and care for ourselves.
What a nice way to end your comments. This has been such a great, robust, rich conversation, but unfortunately we're going to have to wrap it up in the interest of time. But I want to ask each of you a question that I'm going to challenge you to answer in 1 to 2 sentences maximum. And the question is, with all the current public health challenges and the incredible challenges facing the healthcare sector, why should health professionals engage in climate action, and why now? So Kayla, why don't we start with you, and then we'll do Noe and Harleen.
Okay, climate change impacts every aspect of our health. So we will undermine many of our efforts by not addressing this big issue. We have a very short window of time where we can make these changes, and there are funds available right now through the Inflation Reduction Act and Justice 40 to make these changes. So we have the will and we have the resources available to do this now.
Okay, so Dr. Woods?
It'll make your kids proud of you. And it will also bring you back to that original source of why you went into medicine in the first place.
How nice. Dr. Marwa?
Yeah, I think completely agree. Climate change is a crisis multiplier, and we need to act now. We are being trusted by our patients. For me as a pediatrician, I'm getting that unbounded energy from working with youth. And ultimately, by working on this issue, you fill your bucket of hope, which is my favorite renewable resource, by connecting with community.
Mhm. And I just want to ask if any of you have anything else you'd like to share with the audience.
I have one little follow-up if we have a quick sec. It's in medicine, you can get a B. So we have such a high standard for what we consider knowing something in medicine because people's lives are at stake. It's okay. For example, when I wrote that first letter, that was like a C plus. It wasn't even a B. You can do things that aren't perfect and work with other people and just get it done. It doesn't have to be perfect.
Anyone else want to touch on some of the common themes that we've heard throughout this webinar, that it's important to find your allies, to find people you connect with, to form groups, to connect with your heart and your driver for doing this work? Anyone have any other advice they want to share?
Yeah, I think the one other thing I'll add, and everyone summed it up so beautifully, is, we have a lot of numbers to tell the story of climate change, but stories are what stick with people. And we also have the privilege of getting to know our patients and getting to walk with them through these stories, and just remembering the power of our voice and amplifying those stories, and that those are the things that stick with people. And that's what makes part of what makes health such a powerful lever and tool in influencing meaningful action around climate.
Mm-hmm. Yeah, I agree what you said about stories. I think the quote from Dr. Howard Frumpkin is numbers numb and stories stick, and people will remember your stories. So I think that's also good advice, is to try to find your story and be able to communicate it. So does anyone else have anything they'd like to share? Otherwise, I'm going to turn it over to my colleagues who are going to share some resources. Well, thank you all. I think this has been an incredibly inspirational and informative discussion, and I hope it is giving participants some ideas about how they might engage in climate action. So now I'm going to turn it over to Bhargavi Sampath from the Institute for Healthcare Improvement.
Thank you so much, Amy. I just have to say, what a rich conversation. I'm feeling so energized after listening to our inspiring panelists. I just wanted to share a little bit about IHI's upcoming open school course on decarbonizing care. So in the coming weeks before the end of the year, we will launch our first climate and health course. It's a 3-module course developed in partnership with the University of Colorado School of Medicine, and it'll specifically focus on 3 modules designed for clinicians to increase climate literacy and promote sustainable care delivery. And the module will offer an overview of evidence on the relationship between climate change and healthcare, a deep dive into 6 critical domains for measurement and action in healthcare decarbonization, some guidance on high-impact interventions to reduce greenhouse gas emissions that stem from anesthetic gases, inhalers, and medical supplies and devices. And we've also included some case studies of teams using quality improvement tools for healthcare decarbonization. We are very excited to launch this course, and we hope it'll be the first among many on the topic. With that, I will pass the virtual mic over to Emmy from Healthcare Without Harm to share some of their educational resources.
Thank you so much, Bhargavi, and thank you to all of you, our panelists, and to Dr. Collins for facilitating that conversation. I am just so enriched by knowing that we have you all in our healthcare workforce driving this change at your institutions and in your communities. So just in terms of some Healthcare Without Harm and Practice Greenhealth resources for health professionals, there's a couple here at the top that I wanted to spotlight. The first is for folks that are not familiar with our annual conference. We do host Clean Med every year. This year, it will be in Salt Lake City, Utah from May 21st to the 23rd, 2024. And this is a gathering, really health professionals are welcome. It's also a range of audience members. We have sustainability professionals, we have clinicians, certainly, folks from all sorts of aspects of the healthcare sector, really coming together as kind of a healthcare sustainability conference and a way for folks to learn about strategies and tools and make connections to make progress towards a more sustainable, healthier, and equitable healthcare system. So that's the first piece I wanted to highlight. The other networks that I wanted to spotlight are our Healthcare Without Harm Physician Network that Dr. Collins runs and manages. It's a great opportunity, free to join, way for physicians to get involved and connect. And then I also wanted to point to a sort of complementary initiative, the Nurses Climate Challenge, that is run out of the partner Annie that Kayla mentioned, that she was a fellow with. So I encourage folks to look into the Nurses Climate Challenge as well. And then I listed a whole range of fellowships and scholarships here for health professionals that are related to sustainability or climate action. Not all of them are administered or run by Healthcare Without Harm. There are a range of opportunities out there, but for those of you in the audience that are health professionals, I highly encourage you to check out some of these opportunities to get engaged, fellowship opportunities, scholarship opportunities, ways that you can advance this work, again, in your own career, in your profession, at your health system, and or in your community. So with that, I'm going to turn it over to my colleague, Jessica, with the National Academy of Medicine.
Thank you so much, Emmy. And I just wanted to echo everyone's recent remarks, just thanking our panelists so much and our facilitator, Dr. Collins, for such a rich discussion today. As you can see here, I have several resources that are either current or forthcoming from the National Academy of Medicine that are useful for health professionals. And I'm going to highlight two in particular today. All of these resources are posted on the Climate Collaborative webpage, either currently or in the next few months. And my colleague will be putting a link to that page in the Slido chat. The first resource I wanted to highlight today is a high-level, concise short list of key actions for hospitals and health systems to reduce their greenhouse gas emissions, which was developed by our Healthcare Delivery Working Group. And my colleagues will also share a link to this resource in Slido. This list is meant for hospitals and health systems either starting or seeking to implement actions to decarbonize. This short list can be a key resource for health professionals, either to work with their colleagues or to activate their healthcare organization leadership to start or accelerate their journey. And this list is comprised of 2 informational steps, and there are associated actions and resources for each. Step 1 includes 4 specific actions that hospitals and health systems can take to meet goals to reduce greenhouse gas emissions, such as performing a greenhouse gas inventory or establishing decarbonization goals. And then the second includes 5 high-impact interventions to reduce greenhouse gas emissions, such as those focused on building emissions, reducing anesthetic gas, or reducing physical waste, among others. The second forthcoming resource I would like to highlight today is a series of one-pagers on climate and health curricula across the health professions that is currently in development by our Health Professional Education and Communication Working Group. This will be published in the first quarter of 2024, but at a high level, our working group is putting together a series of resources that will share best practices, exemplars, and case studies for curricular on climate and health education, including decarbonizing the health sector, from the undergraduate to the graduate to continuing education. And we're really looking to engage multiple health professions, from nursing and medicine and pharmacy to dentistry, social work, public health, just to name a few. And as mentioned, this resource is forthcoming in early 2024. And for this and the other forthcoming resources from the collaborative, we do encourage you to sign up for our monthly listserv, which we've posted in the Slido chat as well. And now, to conclude today's event, we would like to ask 2 closing questions using the Slido feature again. As a reminder, you can join either using the QR code on the screen with your smartphone, or you can go to slido.com and enter the code that is listed on the screen. And I will wait a moment for you all to access Slido before we ask the first question. We could go to the next slide, please. So the first question is, how would you best describe your role at your organization? As you can see, these options include sustainability professional, healthcare professional, academic, nonprofit, other, student, and facilities staff. And I can see now that some of you have been submitting your responses. We're at about 44% healthcare professional. We see representation across nonprofits, sustainability, other, academic, students. It's great to see such a wide variety of attendees today. Great, thank you for answering our question. And if we could go to the next slide, please. We're going to ask a second question. What one word captures your feelings about health professional engagement and climate action? And again, please use the QR code in the upper left-hand corner if you would like to use your smartphone to access Slido, or you can type in slido.com and enter the code in the lower left-hand corner. And as I see here, the strongest word that's being inserted is hopeful, which is wonderful, but we also see words like critical, challenging, in addition to exciting, encouraged, promising, necessary. I'm going to wait another few seconds for folks to add additional words. And as we're waiting, I just wanted to share the results of the first question that we asked, in which we were seeking your familiarity with the topic to be covered today. 52% of you said intermediate, 28% said beginner, and 20% said advanced. And as we can see here, as the word cloud continues to be populated, we see the words necessary, hopeful, essential, urgent, and critical as some key themes when we think about health professional engagement and climate action. Thank you all so much for answering those two questions. Now I will turn it back to Dr. Collins for some closing remarks.
Hopeful and necessary. What a nice way to end this webinar. I have always felt that it is personally necessary for me to do this work. And I am very hopeful about the possibility or the opportunity for healthcare professionals to work together and lead change. So I share your hope. So thank you again for joining us. I think this has been a really meaningful and memorable conversation, and I'm glad you all took the time to join us this afternoon. Any questions can be directed to climateandhealth@nas.edu. And we'd love to hear your thoughts about the webinar, hear if you have any questions. And I encourage all of you to sort of remember that doing this work community is important. I encourage you to check out our resources, join a group, get educated, and, really join our community, because the community of health professionals doing this work is really the best group of people I know. And they nourish me and inspire me every day. And I really invite all of you to join this incredible community. So with that, I think we're going to close. Thank you again for spending your afternoon with us.